FGF23 is synthesized in bone, and physiologically is active in gut and kidney. In gut, it decreases phosphate absorption, and in kidney, it increases phosphate exertion, and in summary, there is decrease of phosphate serum values. There are a few conditions related to chronic hypophosphatemia because of excess of FGF23. We will speak about X-linked hypophosphatemia, that is a rare genetic disease. We have around 70 patients in Israel, 34 in our hospital, children and adults. The clinical features are disproportional short stature, frontal bossing, leg varus or valgus or windswept, bone pain, limited walking, dental abscesses without caries because of dentin and enamel problems, hearing loss sometimes, and on X-rays is obviously rickets in the serum is low phosphate and high FGF23. A traditional treatment that we give for a long time is oral phosphate substitution up to 5 times per day, together with active vitamin D to correct hypocalcemia caused by phosphate and prevent hyperparathyroidism. This treatment has low compliance, limited efficacy, high rate of adverse events like hyperparathyroidism despite of alpha-D3, hypercalciuria, nephrocalcinosis, and in adults there are enthesopathies. That's why we are very happy to have new treatment. This is Burosumab, Crysvita, commercial name. These are recombinant FGF23 antibodies. Clinical studies demonstrated good improvement in rickets activity, better function, better linear growth, normalization of biochemical values, and favorable safety profile. This drug is FDA and EMA approved, and in January this year, it entered the Israel Health basket. In this report, I show the results of 6 first patients in Israel treated by this medication in the limits of early access program. So there are children from 18 to 4 years of age. Some of them have mutations. We found them. In some of them, we didn't find the mutations. But all of them present typical anamnestic, clinical, and laboratory picture of X-linked hypophosphatemic rickets. All of them were treated with traditional treatment for a long time, and Crysvita they received for 10 months, and one patient, the first one, already 18 months, 1.5 years. I will start with a presentation of rickets activity. So this is the girl, 4-year-old girl with the longest treatment period by Crysvita. She had highly active rickets at the beginning that very fast improved at 6 months, even more improved at 1 year, and continued to be close to normal in 1.5 years. This is X-rays of other 5 patients, showing in all of them good improvement in the rickets activity from the beginning to 9 months of treatment. And these are 2 brothers. 5-year-old brother, a child with active rickets, 8 months treatment with Crysvita, and still the rickets is active, so he is non-responder. but his sister has good response. If we want to put number on rickets activity, we use touch rickets score that has 3 grades of 0, 1, 2, 3 scale for the deepness of rickets in femur and tibia separately, and multiplier from 0.5 to 1, depending on how wide is growth plate involved. Rickets score in our 6 children have shown higher activity from the beginning and very fast dramatic decrease during the treatment period. When we make statistics, we show that the change from baseline to 9 months is statistically significant. And now the deformities. This first patient, 4-year-old girl, has shown dramatic improvement, spontaneous, without surgery, of her both legs on Crysvita treatment. Despite she had treated by conventional treatment at the beginning, until this time, she developed very severe deformities. And this girl is 11 years old, that was operated because of varus here and here also, with 8 plates 3 months before beginning of Crysvita. And on 8 plates and Crysvita together, there is good improvement. These 2 brothers, Noners Burner, the boy Noners Burner, still he has mild deformities, relatively mild, that were not worsened during 9 months of Crysvita treatment. The girl has mild valgus that was not worsened also. And these are 2 remaining children that had no significant deformities and therefore were not followed. Regarding the growth results, the growth was a bit stagnated before treatment, and growth rate improvement very fast during the first 3 months, and continued to be higher than baseline, but in lessened pace. We checked function by questionnaires. So questionnaires show us the better function, better physical activity. But this is another way to check the function, the bioimpedance, when we measure body fat and muscle mass. And all 4 children that were checked by this machine show decrease in body fat and increase in body in the muscle mass, despite we didn't use any other intervention except Crysvita. Regarding biochemical efficacy markers, there is a phosphate levels in all of patients. The phosphate increased. Not in everybody it increased above the normal. And 1 patient, this non-responder boy, has decrease of phosphate levels. I don't know, by the way, why he doesn't respond. He is on the severe side of spectrum with very high levels of IGF-23 in the blood. I think he needs more dose. Serum alk-phos as a marker of rickets activity decreased in everybody. And this is safety marker, serum PTH. It was high in 2 patients at baseline, and in 2 patients it had borderline activity, and all of them decreased under the cessation of traditional therapy and the use of Crysvita. Sorry? The same regarding the calcium creatinine. In 2 patients with high levels, calciuria decreased. Adverse events were very mild, local redness and swelling, and that's all. In 1 patient, there is increase of phosphate levels that were gone down under decrease of the dose. The conclusions are Crysvita increased serum phosphate and improves RHCC score. This is translated into better growth and higher function. Leg deformities were shown in 1 patient to improve spontaneously, but still we need to follow it carefully until we have more experience. In some patients, phosphate levels were not achieved, the normal levels. So I think it's very important to look on the X-rays to see RHCC score, not only phosphate levels, as monitoring. Okay, so this is our team. All these people came together to research the rickets, to try to find out unresolved questions, not only on orthopedics, but also dental problem, endocrinal growth, and cardiac problems also.